Good morning, everyone. I'm Patrick Bear. I'm an economist at the World Bank, and I'm very happy to welcome you to our session this morning on heat vulnerability affecting workers, healthcare, and neighborhoods. This is a rapidly expanding area of research that has important implications for how we design equitable adaptation policy to climate change, and so I'm very excited to hear what our presenters have to say this morning. Before we get started, I just want to thank the sponsors of the Climate Adaptation Symposium. They made this possible, and their generous contributions are really appreciated. The session this morning, we're going to have 3 speakers. If you would like to ask questions, please use the question and answer chat. It should be in the bottom right of your screen. You can move the widgets around and resize them if you prefer to see a larger version of the slides. I'll be monitoring the question and answer, and at the end of each presentation, we'll have an opportunity to review some of the questions, and then at the end of the overall panel, we'll also have a question and answer session. So we have three speakers today. The first one is Juliana Helo. She's going to talk to us about temperature and morbidity in Colombia. So take it away.
Thank you, Patrick, and good morning, maybe good evening to some. My name is Juliana Helo, and I am a postdoctoral fellow in the economics department at Universidad de los Andes. Today, I'm going to talk to you about temperature and morbidity in Colombia. So this is pretty much work in progress, so all of your comments and feedback are welcome. So let me start by motivating this paper. So the changing climate has spurred an interest in quantifying the economic damages associated to this environmental risk. And environmental risks or economic damages usually include, but are not limited to, losses in agricultural productivity, losses in labor productivity, losses in biodiversity mass, and human health. And so the costs associated to human health have been of particular interest, not only because health is valuable on itself, but because of its productive side. Out of the outcomes related to human health, mortality has received much of the attention. And in fact, there has been an effort to quantify the cost of climate change in terms of mortality risk based on empirically founded estimates of the relationship between short-term variations in temperature and mortality. And what do we know about this relationship? We know that instances of extreme heat and extreme cold increases mortality with close to zero effects at mild temperatures. And this has given rise to what the literature calls a U-shaped relationship, where most of the action occurs at very cold or very hot temperatures. But death is an extreme outcome, and we know much less about the effects of temperature shocks on morbidity or health outcomes that not necessarily result in death. And so ignoring morbidity outcomes might lead us to underestimate the cost of climate change and miss any direct burden that climate change might be imposing in health systems. Moreover, shedding light on this relationship between temperature shocks and morbidity can help us understand whether health systems could serve as a mediating factor between this relationship of climate and mortality. And in fact, access to healthcare could serve as a mechanism or as an adaptation strategy between climate and mortality. So what do we know about this thin but growing literature on the relationship between temperature and morbidity outcomes? We know that emergency room visits and hospitalizations increase after the exposure to extreme heat or extreme cold temperatures. And this increase in demand for services is mainly attributed to external factors or cardiovascular illness and diabetes. Moreover, we know that fetal exposure to extreme heat also affects health outcomes at birth. So but when you look closely into this literature, growing but thin literature, as I have mentioned, you see that most of the evidence comes from developed countries, which tend to be located in the temperate region. That is, we have evidence for a few states in the US, some European countries, and some cities in Europe. But there are reasons to suspect that health responses in countries that are located in other latitudes, particularly in tropical latitudes, might differ from what we know from the temperate regions. So on the one hand, on average, tropical latitudes tend to host lower income countries that usually have weaker health systems. Moreover, there are differences in environmental risks between places in the tropical areas versus the temperate areas. So for example, in tropical areas, populations are exposed to a much narrower range of temperature throughout the year, given the lack of seasonality that is faced around these latitudes. That is because they are close to the equator, so given their closeness to the equator, temperatures remain almost stable throughout the year. So I'll give you an example. I'm based in Bogota. Bogota's average temperature is around 60 Fahrenheit throughout the year, so no extreme hot temperatures or no extreme cold temperatures are observed in a place like Bogota. And Bogota's temperature is fairly comfortable throughout the year. And this is true across many of the places in the tropical areas where basically temperature depends on the altitude gradient. Moreover, or the additional environmental risk that might differ is that the relevant causes of death or morbidity might differ between latitudes. So, for example, infectious diseases are very prevalent in tropical places, and infectious diseases like vector-borne diseases, for example, have been documented to react to temperature, and this might impose um, an additional threat to health in a tropical country that might be different from a place like in a temperate region like the US, for example. So in this paper, basically, I'm going to study the health responses, the responses of health services usage to temperature changes in a tropical developing country like Colombia. So I'm going to use the universe of services provided by the health system combined with fine scale weather data, and I'm going to show you that hospitalization rates monotonically increase in the mild temperature range that you observe in a place like Colombia. Moreover, hospitalizations due to infectious diseases and maternal or pregnancy care or related care mainly explain these results. And these are novel findings because, as I told you before, most of the effects have been found at the extreme ends of the temperature distributions, very, very hot days or very cold days, and I'm finding effects at mild temperatures. And moreover, these mechanisms through which this temperature morbidity relationship arises are slightly different from what the literature has documented. So now let me tell you in detail what I do, and I'm going to start by describing my data sources. So temperature data comes from the reanalysis product ERA interim. This product basically combines observational data and forecast models to produce the balance panel at the grid level. This grid is approximately 0.125 times 0.125. And with this grid information, I produce average daily temperatures at the municipality level. So I construct a discrete version of the annual distribution of temperature at municipality level. Municipalities are the smallest administrative units, and I have approximately 1,100 of them. So this is how the the annual distribution of daily average temperature looks like. So basically what I take is the daily average and construct this distribution by classifying temperature in 7 different categories or bin. Each bar in this graph is going to represent the number of days per year that the average person experiences in each temperature category. So you see that the coldest temperature in a place like Colombia is everything less than 17 degrees Celsius, which is approximately 62.6 Fahrenheit, and everything above the hottest temperature is everything above 27 degrees Celsius, which is approximately 80 Fahrenheit. So you see, I have 7 of these bins. If you are familiar with this literature, you might see here now that the temperature distribution in Colombia is much narrower than what you observe in the US, where extremes are above 80 or 90 degrees Fahrenheit and below 10 degrees Fahrenheit, for instance. And my temperature bins are much narrower. So I need to construct temperature bins very narrow so that I have enough variation in temperature to find results. And so this is my main variable of interest. I'm going to use this annual distribution of temperatures in my empirical specification to capture any nonlinearities that might arise in the temperature morbidity relationship, pretty much a la Deschênes and Greenstone. Regarding morbidity data comes from the CISPRO system that is compiled by the Ministry of Health and Social Protection from 2009 and 2016. I have 4 outcomes available: consultations, procedures, hospitalizations, and emergency room visits. But in the interest of time, I'm going to show you only results for hospitalizations. I can classify each type of service according to the classification by the World Health Organization. And with this, I can aggregate the total number of cases reported by year by municipality. So this, combined with my temperature data, produces a balanced panel with approximately 8,000 observations. So this is my main empirical strategy. So I construct a morbidity rate per 100,000 inhabitants for municipality I in year Y. In this particular presentation, my morbidity rate is going to be hospitalizations per 100,000 inhabitants. I'm going to use the temperature variables that I described a couple of minutes ago. I'm going to use my 7 temperature bins, excluding one. In this particular case, I'm going to exclude the reference bin 23 to 25 degrees Celsius. And the parameters of interest are going to be these betas, which are interpreted in the following way. So 1 additional day in temperature bin J is going to change annual morbidity by beta J per 100,000 inhabitants relative to the impact of a day in the reference category, which is 23 to 25. All of my specifications are going to control for precipitation. I'm going to include municipality fixed effects and department by year fixed effects. Department are similar to states in the US to control for any trends in mortality rates, in morbidity rates that are common across states. And I'm gonna be I'm gonna be clustering my errors. I'm gonna use standard errors clustered at the municipality level. So this is my main finding of my paper. So what you see here is that hospitalization rates increases in temperature and throughout the temperature distribution that you observe in Colombia. So this graph is plotting all of the beta J's that I showed you in the empirical specification. So each dot represents a beta J. On the x-axis, you have each temperature bin, and how you interpret it is in the following way. So for example, for the 27-degree Celsius bin, exchanging a day in the reference bin of 23 to 25 for a day above 27 is going to increase hospitalizations by 29.6 per 100,000 cases. So this is approximately 0.86% of the average annual hospitalization rate that you observe in the country. Similarly, in magnitude, you have the effect for a bin for days below 17 Celsius. It's also approximately 0.8% of the average annual hospitalization rate. So in trying to understand the mechanisms that give rise to this relationship, I estimate my empirical specifications separately for type of diagnosis. So I find that infectious diseases and maternal care mainly explain the increase in hospitalization rates. The graph that I have here is the response function for each of the different types of diseases that I have, highlighting the ones that react to temperature. So though in absolute terms, the biggest effects come from pregnancy and respiratory and external causes of death, infectious diseases is here, the black line. Relative to the annual hospitalization rate by diseases, the biggest effects are found in maternal care and infectious diseases. If I do the same exercises using consultations or using ER visits or using procedures, you see the same pattern emerging for infectious and maternal care related consultations and health system demands. So in trying to link these estimates, so the estimates that I showed you as of now is the relationship between short-term variations in weather with morbidity. So in trying to link these short-term estimates to the potential effects of climate change, I'm going to use the observational data on how the temperature distribution in Colombia has shifted over time. So the graph here plots the annual distribution of temperature for 2 time periods in Colombia, from 1985 to 2008, which are the dark gray bars, and for the period 2009 to 2016, which are the light gray bars. And the pink bars represent the change in that distribution. So you see that indeed, Colombia has become warmer. The distribution has shifted to the right and it's becoming warmer, but most of the action is not seen or observed at the very extreme hot temperatures, but mainly in the middle of the distribution between 19 and 23 degrees Celsius. So assuming that the temperature distribution will shift as it has been shifted over the past years, and that no further adaptation mechanisms are undertaken, I estimate that a shift in temperature, as the one that we have been observing, is going to result in approximately 1,100 additional hospitalizations per 100,000 per year. This is approximately 33.6% of the average annual rate. So these results suggest important increases in demand for services if temperatures continue to rise the way they have been rising so far. But more, in addition to these additional costs that the health system might be bearing, these results also suggest that health systems could help mitigate the adverse effects of climate change in health. So just to conclude, this paper is advancing our understanding of the morbidity temperature relationship in a tropical developing country. I show that even small variations in mild temperatures affect morbidity, and most of the effects comes from increased consultations through infectious diseases and maternal health healthcare. And finally, health systems might play a significant role in reducing the impacts of climate change. I'm still exploring this hypothesis, but is what I have so far. So at this point, I'm going to stop and happy to hear your comments and questions.
Thank you, Juliana. That's great. We don't have any questions in the question and answer session yet, but if there are questions, please type them in and I can review them and pose them. I'll start with one though. You show that there's monotonic increases in hospitalization across the temperature range in your data, which is much lower than what has historically been shown in this kind of work. How much of that do you think is explained? I don't know how much humidity varies in Colombia, but how much of that could be explained by variation in the heat index that isn't necessarily reflected in changes in the temperature?
So I'm exploring that. I mean, I'm constructing some humidity variables to control for that. So what I can tell you as of now is that I have done this with mortality data, controlling for humidity, and results are unchanged. So in the hot part of the distribution, the point estimates are a little bit smaller, but the story is the same. So humidity does have an important effect in explaining at least mortality. My guess is that it will have an important effect explaining morbidity, but it's not confounding that much the estimates from temperature.
Mm-hmm. And then I guess a second question, that you show a lot of your largest effects come from pregnancy, and there's a pretty stark increase, not just at the higher temperatures, but also consistently from low temperatures all the way through to moderate temperatures. Do you have a sense for what is driving that? What is it about even mild temperatures that may be causing difficulties with pregnancy?
So I've done it I've estimated the relationship by subcategory. So it's about fetus health, that it's driving mainly this relationship, and also some maternal diseases, for example, like diabetes and things like that. As of what exactly the relationship between heat and maternal health, I'm exploring that, but it comes mainly through fetus health and some particular diseases for the mother, which is something like diabetes and other these types.
Okay. So Paul has a question. He said he's curious to hear your plans for exploring the health systems hypothesis. So how do you plan to examine how health systems might reduce the impacts of climate change?
I'm exploring. I don't have an answer yet. So if you have any ideas, happy to hear them. I have information on, so Colombia underwent an important health reform in 1993. Basically, unlike many other developing countries, access to healthcare is quite important. I mean, most of the populations have some access to healthcare. So I might explore differences in access, or in access to private versus public or something like that. But I'm not sure. If you have any idea, happy to hear them.
Okay, great. So I think that's all the questions. So I think we'll move on to our next speaker.
Thank you very much.
So our next speaker is going to be Andrew Ireland from Monash University, and he'll talk to us about heat and worker safety, an issue that's certainly close to my heart.
Thanks, Patrick. I know you have a recent working paper on the same sort of topic, so you'll notice there's some sort of overlap in the types of questions we're kind of asking. Yeah, so I'm a PhD candidate at Monash University Center for Health Economics based in Melbourne, Australia. And the work I'm presenting today is the joint work with my supervisors, Professor David Johnston and Dr. Rachel Nutt. The study focuses on the impact of heat on workers' safety. And to do this, we're going to utilize a large administrative database of occupational health claims from Victoria, Australia. And we're going to see whether heat has an impact on the incidence type and severity of claims. The scale of the database enables a rich heterogeneity analysis to identify the type of workers and workplaces that are most vulnerable to the impact of heat. So this is an important relationship to study, firstly because occupational health is very costly. Each year in Australia, almost 1% of workers suffer a serious accident while working. And annually, the work-related injury and disease costs the Australian economy about $61.8 billion, which represents about 4.1% of GDP, with similar estimates applying in other developed economies. Secondly, we expect that heat might have an adverse impact on safety. Firstly, because there's physiological limits on the human body such that in extreme heat, the dissipation of heat becomes more difficult, which could result in more accidents and related to dehydration and heat stroke. And secondly, lab experiments have shown that in high temperatures, that can reduce concentration and psychomotor performance, which is another plausible mediative pathway for additional accidents. And with global temperatures having increased and continuing to rise, any adverse safety impacts of heat are likely to increase as more workers are increasingly exposed to heat in the workplace. So this study forms part of a very active and recent literature that links heat to health and economic outcomes. And most related to this particular study are 3 papers from the United States. The first, which has been published in the Journal of Human Resources by Marcus Dillander, shows that in higher temperatures, there are significantly more accidents, using data from Texas and the mining industry in the United States. And he finds that in warmer climates, the effects are larger, which he infers suggests that there are limits on the ability to adapt. A second paper from Page and Shepherd show that the adverse impacts of heat extend to industries that are seemingly unrelated to weather, such as retail, hospitality, and education, but to a lesser extent than primarily outdoor-based industries, and that's something that we find to also apply in our context. And finally, the paper with Patrick so has recently released as a working paper with Bisung Park and Nora Prankratz shows that the type of claims occurring more frequently in heat are not limited to heat stress, and that's something that we also are able to replicate in our context. And they find that workers in low-income postcodes are disproportionately affected by heat. However, we don't find this to hold true in our context using claimant-level income. So I believe this study builds on the existing literature in a number of ways. So to my knowledge, it's the first comprehensive sort of causal study on the topic outside the United States. Victoria has a mandatory workers' compensation scheme, which is not the case for much of the United States. We investigate the impact of heat over time using a 35-year analysis period. There's some unique advantages of the data source we use. It contains the date of affliction for each claim, whereas many studies previously use claims or dates related to when the claims were reported. We show the effects of heat by age, gender, income, and industry within the same occupation group to see whether these demographic variables matter when looking at a more similar type of workers. And we also have further evidence on the heterogeneity and the effect of heat on different accident and injury types to give some insight in the type of mechanisms driving the temperature safety relationship. So just a little bit of background on how workers' compensation works in Victoria. So since 1985, workers' compensation has been mandatory in Victoria, and currently employers must pay premiums to cover the cost of injuries incurred at work. And the claims can be for both medical expenses and weekly benefits for time away from work. The scheme covers about 85% of the labour force because there are a few exemptions for workers who are essentially covered by other schemes, such as federal government employees like Defence Force, and as a list of self-insured companies as well. There's been some changes to the scheme, particularly in the earlier years of the scheme, and that sort of it reflects in the number of claims earlier in the scheme having a bit more volatility. But there's been no real major changes in the past 20 years or so. On average, there's about 209 claims per day in Victoria, and that's sort of gone down a little bit over time and sort of stabilized in the last 10 years or so, as seen in the chart on the right. The other thing to note from the chart on the right is that there's some seasonality, whereby January and December each year have the fewest number of claims, and they also happen to be the hottest months, but this is very likely driven from the fact that this is when people take the most holidays. There are a lot of useful fields in the data source we use. So as I mentioned before, we have the postcode and date of affliction, and that's what we use to match on climatic variables. There's a lot of information about each type of claim and the accident. We also have some useful demographic information such as age and gender, and we know the pre-injury income of the claimant, the occupation, and some information about the type of employment. We also know we have unique identifiers for employers, and we know their industry and size. So we model the number of claims each day in each postal area as a Poisson distributed random variable. And we include regional and time fixed effects to account for time-specific characteristics that remain constant across locations and unobserved regional characteristics that remain constant across time. And as with many studies in this panel sort of literature, we utilize short-term weather variation, which we assume to be exogenous, to give our results a causal interpretation. The preferred specification we use includes month-year postal area fixed effects. So this type of variation means that, for example, if you compare 2 days, both in the postcode for Melbourne, and they're both in December in the year 2000, and one was 30 degrees Celsius and the other was 20 degrees Celsius. That's the kind of variation we're using in our model. Does that have an impact on the number of claims in that postcode? We can also control for other variables such as the day of the week, precipitation, and air pollution. And we use robust standard errors clustered at the postcode level, since postcode is the level which the weather or the treatment is assigned. And we restrict our sample to just weekdays and postal areas with at least one claim each month. Okay, so now we're into the results. First, we just model the linear effective temperature. And we see that using a few different specifications, we find that across these specifications that higher temperatures significantly increase the number of accidents. So we find that for each degree Celsius, in the preferred specification, which is column 3, that results in 0.24% increase in claims. We use specification 3, which has month-year postal area fixed effects as opposed to separate year-month and postal area fixed effects to allow for seasonality to differ by locations, given diversity in Victoria's economy. However, using other specifications don't change the results a great deal. And we control for precipitation as well. And we show that this is robust to just dry days as well. So, and amongst a number of other things. Next, we have a look at the results in this cross-tabulated format for occupation in the years prior and post the year 2000. And the thing that really stands out firstly is that, as might be expected, the effective heat is really concentrated primarily on tradespersons, labourers, and related workers. So if you look at all years throughout the 35 years, the effect for tradesperson is 0.38% for each degree Celsius, and 0.33 for labourers. The next point to note is that the impact of heat has reduced a little bit over the 2 time periods, however, not evenly across the groups. So there's some heterogeneity in the way that different workers are able to respond to changing climate. So there's been less of a reduction in those primarily affected employment groups compared to others. And in particular, there's relatively large standard errors on these, but being a smaller group, but managers and administrators seems to have reduced the effect substantially. And this would be consistent with the increased adoption of air conditioning throughout the 35-year period, whereby sort of indoor workers, it may be an effective form of adaptation, but less so for other types of workers. So next, we continue to explore the effect over time, and we're just focusing here on labourers and tradespersons, which we'll do throughout the rest of the paper. And using five-year bins for year groups, we notice firstly that the adverse impact of heat is observed throughout the entire analysis period, with results being significant throughout the period. And secondly, we note that the hottest years, which have been the years since 2015, have the highest point estimate, which we can't rule out being statistically significantly different from the other estimates, but nonetheless, it is the highest estimate. And this would be consistent with Dialesandro's finding on limits to adaptation. So in his paper, he finds that in warmer regions, there's a larger effect, where I'm sort of saying that in warmer time periods, we find the largest effect as well. So it would be consistent with that idea. So up until this point, I've just shown you the results being as a linear approximation, and it's not obvious that that's a sensible thing to do. It may be any number of other shapes. However, we do find that a linear approximation is suitable for, and with much of the temperature distribution just following a linear trend. So we've used a non-parametric approach to test if linear is a suitable functional form with 3 degree Celsius bins for maximum temperature. And we use the temperatures between 18 degrees to 21 degrees, which is about 66 degrees Fahrenheit as a reference category. And we find that, firstly, that for much of the distribution of temperature, it does just monotonically increase. Secondly, we don't observe any sort of increase in claims for extreme cold temperatures. And this may just be that in Melbourne or in Victoria, we don't experience temperatures cold enough for to observe any increase. But what it does imply, at least in the context of Victoria, that any increase in temperature will only have a negative effect on safety. And finally, we do notice that in the extreme temperatures above 36 degrees Celsius, which is about 97 degrees Fahrenheit, although it's still higher than the reference category, it's significantly lower than the effect for temperatures between 33 and 36 degrees. And so this linear shape, it suggests that there's something more than just dehydration and heat stress, and perhaps other, and hopefully I can convince you later in the paper when we look at different accident types that other types of pathways are important, such as concentration. I think that would be consistent with this sort of shape we see. These results are comparable to the studies from the United States in terms of their effect size, with the big difference being the Texas study doesn't see a drop-off in extreme high temperatures, and the study from California sees a little bit of a drop-off, but not until sort of higher temperatures. And Victoria does have a lot of heat policies in place, and this drop-off might be consistent with those policies having an effect. So, for example, construction workers in Victoria stop working from all unionised sites when workers exceed 35 degrees Celsius throughout much of the period. So this drop-off is consistent with that, considering that the results are what we measure is a residual risk after the ways that workers respond. Next, we have a look at the effect by industry. So like some other papers have shown, there's considerable heterogeneity in the effect by industry. And when we look at the effect by industry within just labourers and tradespersons, some of this effect is diminished. So, for instance, the effect for manufacturing is higher than other industries, and I'm just displaying these three industries as these are the ones that have a high number of labourers and tradespersons. But the effect for manufacturing is not so different than other industries when you look within labourers and tradespersons. And what really stands out as well is the effect for agriculture in particular, but also construction are very large. So, and this is likely because they're more likely to be spending more time outdoors. So next we have a look for different kinds of vulnerable workers. So first, when we look at by gender, we see that the effect for males is much higher than the effect for females. And this is consistent with what previous studies have shown, showing that males are bearing more of the burden of the decreased safety from heat. However, I don't believe that gender should be a sort of an independent risk factor as such when we look at more similar types of workers. So when you look at just labourers and tradespersons in agriculture or labourers and tradespersons in construction, there's really either no difference between males and females and actually higher point estimates for females. We do the same thing for age, and we see that highest effects overall for younger and older workers. And within agriculture in particular, workers above the age of 50 have a particularly large estimate. And in construction, both younger and older workers. So there may be a few things going on here. Perhaps younger workers might be doing more dangerous types of work, and older workers perhaps might be more vulnerable. But we don't see a monotonic relationship here.
Andrew, just a quick nudge. We're at time, so we can go into the QA session a little bit, but
okay,
just try and wrap up.
Okay, thank you. So finally, just by wages and employment size, we see that we don't see any real difference by wages using the income level of the claimant. And for employer size, we do see that in construction, a lower effect for large companies, which do have some of those policies in place to reduce worker supply. Just quickly have one more results slide, and that just to wrap up, and just showing the effect by different accident types. Just 2 points to take away. The first is that heat has a direct impact on creating additional hazards. So it's beyond just heat having a physiological impact. So because we see large effects for things like chemicals and substances, which might be more volatile in heat. And secondly, the biological impact of heat isn't really just limited to heat stress and dehydration. So we see no effect for things like diseases and mental health, which might be expected as a kind of nice sort of placebo regression. But we do see an effect for various types of claims like hitting objects and being hit by objects, which you know, and might be more suggestive of that kind of concentration type pathway. And that's my final slide. So happy to answer any questions.
Great, thank you. That's fantastic work. I think this is a really important question, and having more evidence from other places in the world is really great. We have 2 questions in the chat, and we have about 2 minutes left, so I'll just give you both of them and then let you answer as how you'd like. The first is from Francis. How would you apply this research to policy resolutions when advocating for worker rights to things like water breaks, which I know in California are on the line right now? And then from Brian, he wants to know if your outcome of interest is the number of claims as opposed to the rate of claims per worker hours. And then if in Australia, since there's a large amount of seasonal variation in employment or working hours, is that affecting your results, especially when you look across different classifications of workers and industries? So we have about a minute left of the Q&A. So I'll let you pick which one of those you want to answer, and then maybe you can answer the other one in the chat. Okay,
yes. So in terms of is the month, because we use just looking at variation within a month, that shouldn't really be an issue, but I'll expand on that in the chat. But water breaks and such, I think a really interesting policy question to evaluate is, and what I will do on this research is about some of those heat thresholds that apply in Australia for workers to cease work at certain thresholds, and how that impacts both labour supply and the number of accidents. So that's a plan I have for future research. And I think I'll best probably just answer the questions in the chat.
Okay, great. That's awesome. Thank you. That's a great job. Our next speaker is Jake Dialesandro from UC Davis.
Thank you. Good morning, everyone. This paper is entitled Reducing Thermal Inequity, Identifying Vulnerable Neighborhoods and Heat Mitigation Potential for Urban Cooling in 2 California Cities. Let's see. Before I get started, I just would like to acknowledge my co-authors, which is Dr. Noli Brazil, Dr. Stephen Wheeler, and Dr. Helen Dalk at UC Davis. So as Juliana and Andrew pointed out, urban heat, especially when it's exacerbated by climate change, causes a big threat, and it's something that is very pertinent today. The burden of excess heat is not equitable amongst populations. And what I mean by that is, kind of as Andrew pointed out, how some workers are more exposed, even outside of the work industry. Certain populations and demographics share an unequal burden of heat, as well as the negative impacts of it, which would be heat-related mortality, morbidity, and even increased energy use. Oftentimes, these people who have inequitable exposure or vulnerability to the heat have the least amount of capital to combat or mitigate it. And when you look at mitigation initiatives, cities often lack the resources to implement heat mitigation at a region-wide scale. And what I mean by that is cities often, for like tree planting initiatives, don't have the financial resources or even the water resources to plant trees all over the city. So if we were capable of identifying areas that perhaps need it most, that would be very beneficial. So for this project, we had a number of objectives, but first and foremost, we just wanted to map the footprint of heat. And what I mean by footprint is just the surface temperature for both day and night for 2 cities in the Central Valley. Fresno and Bakersfield were our regions of interest. We then wanted to develop a vulnerability indice using census data at the block group level, just to identify the neighborhoods that have the highest vulnerability to excess heat. And we used a thing called a principal component analysis, and I'll go into that a little further when we get to the methodology. We also wanted to benchmark the relationship between temperature and these demographic variables. So like, how does income and temperature relate? But then also, how does biophysical variables such as tree canopy at the neighborhood scale relate to temperature? Finally, we use the Invest Urban Cooling Model, which is another thing that I will elaborate on in the methodology, to model the cooling potential of planning interventions such as increasing surface albedo or increasing tree canopy. And the two cities under investigation are two cities around 500,000 people. They have hot summer Mediterranean climates bordering on desert. Actually, Bakersfield, one of the cities, gets only 185 millimeters of rain a year, which would fall into the category for a desert. Fresno, slightly more than that, but very close to a semi-arid climate. Both of these cities have large amounts of impervious surface and extremely low tree canopy. So the data that we used Landsat 8 operational land imager thermal infrared sensor and the International Space Station EcoStress satellite. This was a satellite that was actually launched quite recently, June of 2018. And what we used these data for is we used it for land surface temperature, but we also used it for evapotranspiration and albedo, which went into the urban cooling model, which I'll elaborate on. And we also used it to get the thermal magnitude. And by thermal magnitude is basically we took reference areas, which would be an area that's undeveloped in a periphery or adjacent to the developed area of one of these cities, and compared it to the warmest temperature that was found within the urban core. And that was an important input in the model that I'll be discussing. We also used American Community Survey data for the 2015 to 2019 census. We used variables of race, income, education, and language proficiency, and these went into the principal component analysis. We chose these variables based on the literature. There are a lot of variables that you could use, including median home price. If we had gone up to the census tract level, we could have also used health indicators from the CDC, but we wanted to do it as fine a scale as possible, so we ended up using block group data. We also use ancillary data. The California Forest Observatory provides a rasters of 10-meter tree canopy, which is very high resolution. And it also has stuff such as crown depth and stuff, but we use the tree canopy for the input into the INVEST model, as well as a variable to compare it to temperature. We also use land use and land cover from the National Land Cover Dataset, as well as impervious surface fraction, which is just another product from the NLCD. And again, these were used as INVEST cooling inputs and statistical analysis of the vulnerability to heat. So this INVEST urban cooling model, INVEST actually stands for Integrated Evaluation of Ecosystem Services and Trade-offs. And they have a suite of ecosystem models, but we focused on the urban cooling model. This was developed by the Natural Capital Project out of Stanford University. And basically, this model aims to quantify the impacts of green infrastructure and other ecosystem services. The urban cooling model actually uses the aforementioned land use and land cover, as well as shade, albedo, building intensity, green area, and evapotranspiration to basically determine the heat mitigation index of each pixel. An output of the model is also a temperature raster, which is based on your input modeling scenarios, which you can compare to baseline to show what the cooling potential is for each of these planning interventions. So for our specific planning interventions, we increased tree canopy by 10 and 25% for 2 model simulations. We did the same thing for albedo. So we increased albedo at 10 and 25% for the developed land cover. And then we did a combined 10% albedo increase and 25% tree canopy increase. One thing I would like to mention is you have a lot of land covers throughout the matrix of an urban area, and we only added tree canopy and change the albedo in areas that were feasible. So for example, agriculture, we weren't planting trees on agriculture land. We were not increasing albedo on barren land or hay and pasture or open water. We only did it on these developed urban land cover classes. So moving into the results, the first thing we did is we mapped daytime LST for Fresno as well as nighttime. And daytime LST varied pretty dramatically, almost 25 degrees Celsius across Fresno, with several areas actually registering temperatures approaching 50 degrees Celsius. Keep in mind that this is land surface temperature, so compared to ambient air temperature, there is a little bit of a discrepancy. The warmest areas were, not surprisingly, the Fresno Yosemite Airport, as well as a lot of broad shopping centers that also had spillover effects into the adjacent areas. And these shopping centers were all impervious surface, very low tree canopy. It may be hard to see here, but along California 99, which is a highway that bisects diagonally across Fresno, you also see pockets of high heat. The coolest areas were in parks and northern and northwestern Fresno, such as Woodward Park, which is along the San Joaquin River, as well as California State University, Fresno, which has a lot of tree canopy and also has an adjacent agriculture research center. And it was mainly like a green space covering, which was showing up as very cool. On the right, you can actually see nighttime temperature, which varied by almost 20 degrees Celsius. And the warmest areas were actually also in these airports, these shopping centers that have high amounts of impervious surface. But interesting to note, in the southwestern portion, there's a satellite portion of Fresno City that's actually the Clovis Fresno Wastewater Treatment Center. And it's showing up very strong in red in the southwestern, or pardon me, in the southwestern corner. And that's a bunch of standing water. So it's not surprising that this is showing up as very warm. We did the same thing for Bakersfield, and actually temperatures varied slightly more, up to 30 degrees Celsius in Bakersfield. The patterns that we found with areas of a high impervious surface, such as the Meadows Airport, which is in northern Bakersfield, as well as the Alon USA oil refinery, which is in the northeastern portion of the study area, also had very high daytime temperatures. Interesting to note, if you look, there's a lot of fallow fields in the agriculture periphery. And these also show up as very high temperatures, basically because there's low amounts of shade and there's it's very barren land. This isn't necessarily consistent with what would be the annual cycle. As plants or crops go through the phenological cycle, this could actually be cool pockets. On the right, you can actually see the nighttime temperature, and you see more of the classic urban heat island. The urban core really shows up in red, and you can really see these high temperatures. And the temperatures varied by up to 20 degrees Celsius throughout the study area for nighttime temperatures. The next thing we wanted to do is we wanted to correlate biophysical and socio-demographic variables to the land surface temperature. There was a strong relationship, or inverse relationship, I should say, between tree canopy and LST. This was actually represented by negative 0.63 R value. Impervious surface had a strong relationship as well. So as impervious surface went up, temperatures also went up. So this was 0.4 as our R value. Nighttime LST was not quite as strong, but did have a 0.32 value for impervious surface. When we look at the demographic variables, the percent of population without a high school diploma, percent of Latinx population, as well as limited English language proficiency had the strongest relationships with temperature. So as those aforementioned populations went up, neighborhood temperatures tend to go up as well. Income was also very strongly correlated to a number of variables. So income and percent without high school education, percent limited English language proficiency, and percent non-white all had strong relationships. So as one went up, the other, or strong inverse relationships, I should say. So as one went up, the other went up as well. In Bakersfield, we actually saw very, very similar outcomes. There was a strong inverse relationship between areas of high tree canopy and high LST. This was represented with an R value of negative 0.74. Those neighborhoods with a high percentage of people without a high school education and limited English language proficiency, as well as percent Latinx, had a strong correlation with higher daytime temperatures as well. All three of these variables are also strongly correlated with one another. And income was extremely strongly negatively correlated with LST. So the next thing that we did was run this principal components analysis to develop a vulnerability indice. So diving into what principal component analysis is, it's actually a statistical unsupervised method that reduces the dimensionality of a data set by grouping them into linearly uncorrelated principal components. This aims to explain the data's variance. So if you have a lot of variables that, income and percent Latinx are very different, especially on how they're measured, but this kind of helps you like correlate them and see how they are related and how they could drive vulnerability, which in our case is heat. We ran the PCA on the heat vulnerability index by first transforming them into z-scores. Z-scores just means that we took the whole data set and we made the mean of each variable 0 and gave it a standard deviation of 1, which better enables us to compare different units and ranges. PCA is really useful to identify spatial clusters of key factors that could be driving heat. As you can see here, we developed 4 PCAs, which explained 85% of our variance, and no high school diploma, percent Latinx, and English language proficiency, as well as income, were very strongly correlated with the first principal component, indicating that they had this high contribution to heat vulnerability. We ran the same thing for Bakersfield, and we actually had 87% of our variance explained by 4 principal components. The first 3 principal components alone explained actually 74%, and they consisted of English language proficiency, percent non-white, percent Black, income, and percent of populations over 65 living alone. And these had both negative and positive loadings, indicating their type of relationship. These results indicate that the social variables of percent of populations with no high school diploma, as well as percent of Latinx, are very important when measuring vulnerability at the block group level. So where are these neighborhoods located? Because we measured out, the vulnerable neighborhoods, but where in the matrix of the city are they located? In Fresno, vulnerable neighborhoods were actually located along the 99 and California 44 interstate. And an interesting thing about this is they weren't necessarily completely grouped together. You had several neighborhoods that were adjacent to very wealthy neighborhoods that had low vulnerability. So it was really more of a matrix of, it wasn't like the east side of the city was all disproportionately exposed compared to the west side. And the same can be true about Bakersfield. A lot of the vulnerable block groups were kind of spread out. But one thing that they did, but they all had variables that were consistent throughout. So our vulnerability analysis shows that neighborhoods vary dramatically in both biophysical and social characteristics, and tree canopy is far lower in vulnerable neighborhoods and impervious surface is far higher. Income is also far higher in low vulnerability, up to 50% versus low vulnerability. Census block groups with the highest heat vulnerability were similar in most cases that actually had high heat readings. The few exceptions were actually in Bakersfield, where neighborhoods along the banks of the Kern River had high heat vulnerability, but the temperatures were actually cooler relative to the whole citywide matrix. So in Fresno, the most vulnerable neighborhoods were actually 4 degrees Celsius warmer than the least vulnerable. And income was actually also $22,000 per year lower, which is pretty substantial. Overall, there was higher populations of those without a high school diploma, higher Latinx, and those with limited English language proficiencies in these vulnerable neighborhoods. From a biophysical perspective, impervious surface was also higher in the least vulnerable neighborhoods, and tree canopy was actually much lower, only about 10 to 20% of the overall city average. In the city of Bakersfield, we saw a similar thermal inequity. So the most vulnerable neighborhoods were 3.2 degrees Celsius warmer than the least vulnerable. And it had a very similar income disparity as Fresno. This, I believe, was $19,000 lower for the block groups that had high heat vulnerability compared to the overall city mean. And the racial and social demographics, as far as like without high school diploma or over 65 living alone, limited English language proficiency, were all very consistent throughout. So finally, we ran the Invest Urban Cooling model to kind of model how these planning interventions could impact urban heat and what benefits they have. So when you use the Invest Urban Cooling model, you have a biophysical table that allows you to adjust the parameters. So for our simulations, we adjusted the parameters for shade as well as albedo. And both of these were, again, only on land use and land cover that could feasibly be changed with planning intervention. So again, we didn't use hay or pasture. We didn't use barren land. We only used these developed land covers. And what we found is that tree canopy actually has a much stronger cooling impact than albedo. Albedo, when you increased it up to 25%, did yield about a 2 degrees Celsius cooling in most cases. However, when you added a 10 or 25% tree canopy, it was far exceeded. In some cases, we had some neighborhoods that benefited by 7 to 8 degrees Celsius from 25% increases in tree canopy. The largest increase we had was when we did a combined 10% albedo and 25% tree canopy increase. However, I think it's important to note that this was only moderately stronger, or not even moderately, but marginally stronger than just the 25% tree canopy increase alone. Also, when we looked at how this cooling affected the neighborhoods that we identified as either vulnerable or not vulnerable, higher vulnerable neighborhoods actually had stronger cooling impacts. So across all 5 model scenarios, the bar graph represented in blue, you can see that the vulnerable neighborhoods had stronger cooling than any other neighborhood, especially low vulnerability. And one thing I wanted to point out is Fig Gardens is an upper middle class neighborhood that is in Fresno, and it has a high tree canopy. It actually had 50% lower modeled cooling. And this would indicate that there's perhaps like a carrying capacity or even a limitation on tree canopy. So maybe you reach a certain percent tree canopy and the cooling effects diminish or don't even exist. With planning initiatives, if you have a low amount of resources, if you know a neighborhood already has high tree canopy, you could maybe prioritize other neighborhoods. Bakersfield, tree canopy also cooling was much stronger than albedo, but however, the cooling overall was less for Bakersfield than it was Fresno. And we also noted that there was less spillover from tree canopy, so the cooling effect really only stayed on the developed areas where the tree canopy was implemented and didn't have like a 1 kilometer effect. That's just kind of what we saw within the city of Fresno. And again, the vulnerable neighborhoods were also had higher benefits from the tree canopy and albedo increases. So kind of wrapping up, in conclusion, temperatures varied widely for both day and night, astoundingly up to 30 degrees Celsius. Vulnerability analysis showed that ethnicity, education level, and English language proficiency is substantially correlated to heat vulnerability. 10 and 25% increases in built form albedo led to a 2 degrees Celsius cooling, while tree canopy could be as high as 4 to 6 degrees Celsius cooling. And of course, as I mentioned, neighborhoods that have this high vulnerability based on our principal component analysis benefited more from modeled planning interventions. And they could definitely be prioritized as the communities to implement these mitigation measures. As you know, with any work, research is certainly involving. So I do believe that this could be enhanced by using more precise land use and land cover. For example, the NLCD data set only uses developed land cover as low, medium, and high, and this is based on impervious surface fraction. And I feel that those areas could be enhanced by if you classified as airport, or even if you did commercial, residential, industrial, it would kind of be able to more finely tune the model. I think running the model for cooling potential for vulnerable neighborhoods only as well would be very good, as well as including survey data, which would be, and CDC health data, mobile data, and then even getting mean radiant temperature compared to land surface temperature. And I just want to thank my co-authors and my colleagues at UC Davis and the NASA Develop program. And I'd also like to thank the Luskin Center for Innovation at UCLA, as well as my advisors. And I look forward to discussing your questions if there are any. Thank you very much for this opportunity to present.
Thank you, John. That's a great job. Super interesting use of the satellite data. Being able to see at a street level where cities are hot or cool is pretty fascinating. There's one question in the chat, and then I had a question too.
Cool.
So the question in the chat is, why do you suspect that tree canopy alone was more effective than the combined increase in both canopy and albedo? Or I guess maybe not more effective, but at least equally as effective?
Yeah, that's a really good question. Well, tree canopy in general, I believe, was more effective because tree canopy in the model cooled via shade and evaporation. Tree canopy is kind of like a double whammy, whereas albedo is really good at reducing temperature at a building-wide scale. So you can save a lot of energy use based on the literature by increasing your roof albedo, but that's not actually going to cool the pedestrians walking by that building. In fact, one thing that is very interesting that some of the research going on actually at the Luskin Center of Innovation noted that albedo actually can raise the mean radiant temperature at the street level and make pedestrians more uncomfortable. So anyway, to answer the question, the reason I think it was only marginally more effective is I think albedo is very good at the building scale, but at the citywide scale or even neighborhood scale, it's just not as effective as having that spillover. I think more research definitely, for myself included, could be done, but that's my theory as why it's not as effective.
As a follow-up to that, what's a policy intervention that would change albedo?
So if I'm understanding you correctly, like a policy intervention would be like just having an initiative to change like literally the color of roofs or buildings. So yeah. So, you know, there are some things going on. There actually has been research to say that it's not even worth it to invest in changing the color of streets or buildings in some cases, especially when you factor in the cost and like the increasing reflectivity. So like in LA or in California where it's very sunny, you really can't have like white roads or else no one would be able to like see and drive. And also the benefit is just so marginal. But it comes at a cost that's free of water. In California, we're very water conscious. So there is, on the opposite side of the coin, you have to say like, oh, okay, well, yeah, at least you wouldn't be spending water when you did this. So to answer your thing about a planning intervention or a policy recommendation, it would be to maybe, you know, focus on increasing albedo at like the 5 to 10% scale, but then focus a lot of the efforts on creating more shade, whether that be from trees or from more built form.
Okay. Thank you. So we don't have, it doesn't look like we have any more specific questions in the chat, but if we could bring back the other two speakers and open it up to the audience, if there are anyone who has questions about any of the three presentations we just saw, I want to make sure I give everyone a chance to ask any remaining questions before we wrap up. So I don't see any more questions. I think we can wrap up. I think if you want to follow up individually with the panelists, if you do think of something, I'm sure they would all be open to that. I want to thank our three panelists today. You guys all did a great job. Thanks to the audience for your questions. And just want to say there's a couple more presentations starting at 10:15. These all look really great. I know I'm going to go to the one on emerging financial adaptations to climate markets, but we also have two on the impacts of climate change in water and climate change in flooding. So make sure to check those out if you're interested. And once again, thank you to the presenters for joining us, and thanks to the audience.
Thank you.
Thank you.
Thank you so much. Thank you.